Hello and welcome to your ultimate guide for your TEAS exam. My goal today is give you everything that you need to understand the full concepts, master them, and walk you through the TEAS exam with total confidence. In this video we will cover vocabulary and reading, writing and grammar, anatomy and terminology, biology and cell science, scientific measurement. With over 100 plus success stories, we have proven our videos will help you pass your exam on the first attempt. And remember, our website helps you to practice your TEAS exam with our practice questions, timed mock exams, and study guides. You'll find the link in the description below. So let's get started.
Question 1. The young resident's prognosis seemed grim. Her mentor reminded her that medicine is full of surprises and that even patients with the most severe diagnoses sometimes recover. As used in the passage, the word prognosis most nearly means which of the following? Your options are A. Recovery, B. Medication, C. Age of the patient, D. Forecast or predicted outcome. Which one is it? Pause the video if you need more time. The correct answer is D, forecast or predicted outcome. D is correct because the mentor's reminder that even patients with severe diagnoses sometimes recover signals that prognosis is the predicted outcome of an illness. The contrast with possible recovery makes a forecast meaning the best fit here. A is wrong because recovery is the outcome itself, not the prediction of one. The passage treats prognosis as something that can look grim before recovery occurs, which means prognosis precedes and predicts the outcome it describes. B is wrong because medication refers to a treatment, not a prediction about the patient's future. Nothing in the passage suggests a drug. The focus is on what is expected to happen with the resident's patients. C is wrong because age of the patient is unrelated to the surrounding cues about severe diagnoses and possible recovery. The passage discusses outlook for an illness, not biographical information about anyone receiving care here. Prognosis is the predicted outcome of a disease, a forecast about where a patient's situation is likely to go. The word itself comes from the Greek pro, meaning before, and gnosis, meaning knowledge. Literally, knowledge before the event. A clinician builds a prognosis from 3 layers. First, the disease's natural history drawn from past cases. Second, how the treatment plan shifts that trajectory. Third, the patient's own picture, age, comorbidities, and support system, which pulls the forecast up or down from the population average. Each clinical term sits at a different point on the timeline. Diagnosis names the disease at the moment of identification. Treatment is the action taken to alter the trajectory. Recovery is what happens if therapy works. Prognosis sits in between, looking forward before the outcome is known. The exam trap is conflating these 4 terms. The key distinction is temporal. Diagnosis looks at the present. Prognosis looks ahead from the present. Treatment changes what comes next. Recovery is what actually happened at the end. When a passage uses words like predict, likely course, or expected outcome, prognosis is almost always the right answer. Hold the timeline in mind. If the sentence looks towards the future, it's prognosis, not diagnosis. Question 2. A writer reads her draft and decides to move the 3rd paragraph after the 5th and rewrite the introduction. Which stage of the writing process is she in? Your options are A. Revising, B. Pre-writing, C. Drafting, D. Editing. Take a second. Which answer would you pick? The correct answer is A. Revising. A is correct because revising involves changes to content and structure, including reorganizing paragraphs and rewriting sections. Moving paragraphs and rewriting the introduction are classic revising activities, focused on overall composition rather than surface mechanics. B is wrong because pre-writing happens before any draft exists. The writer already has a complete draft, so she is past planning and into evaluating and improving the existing content materially. C is wrong because drafting produces the first version of the piece. The writer already has a draft and is now reorganizing and rewriting, which is a separate later stage of the process. D is wrong because editing addresses surface errors like spelling, punctuation, and grammar. Moving paragraphs and rewriting the introduction are content and structural changes belonging to the revising stage instead. Revising and editing both happen after a draft exists, but they operate at completely different levels. Understanding that distinction is the key to mastering writing process questions. The writing process is divided into discrete stages because thinking and producing are different activities. Pre-writing gathers material, drafting builds the first version, revising reworks the whole structure, and editing cleans up surface errors. Revising means working at the macro level, moving paragraphs, cutting redundant sections, and rewriting the structure so the argument holds together. The thesis may shift, the paragraph count may change, and that is revising working exactly as designed. The clearest way to separate the two is by level of change. Revising touches content and structure, reorganizing, cutting, rewriting. Editing touches mechanics, punctuation, spelling, surface errors. If the shape of the piece changes, that is revising. When a test item uses words like reorganize, restructure, or move paragraphs, it is pointing to revising. Words like proofread, fix punctuation, or correct spelling point to editing. Keep that line clear and you will not be fooled. Question 3. Which body cavity contains the heart, lungs, esophagus, and major vessels of the mediastinum? Your options are A. Abdominopelvic cavity, B. Cranial cavity, C. Spinal cavity, D. Thoracic cavity. Before I reveal it, which one do you think is right? The correct answer is D. Thoracic cavity. D is correct because the thoracic cavity, part of the ventral cavity, houses the lungs and the pleural cavities and the heart, esophagus, and major vessels in the mediastinum, separated from the abdomen by the diaphragm. Is wrong because the abdominopelvic cavity contains digestive, urinary, and reproductive organs, not the heart, lungs, or thoracic structures of the mediastinum. B is wrong because the cranial cavity is a subdivision of the dorsal cavity that houses only the brain, not thoracic organs such as the heart or lungs. C is wrong because the spinal cavity is part of the dorsal cavity and houses the spinal cord, not the heart, lungs, or other thoracic contents. The thoracic cavity is the upper portion of the ventral body cavity, sitting above the diaphragm and below the neck. Understanding its structure means knowing not just what lives inside it, but why the body bothers organizing organs into sealed cavities at all. Internally, the thoracic cavity divides into 3 regions, 2 pleural cavities, each holding a lung, flanking a central corridor called the mediastinum. The mediastinum houses the heart in its pericardial sac, the trachea, the esophagus, the thymus, and the aorta. Each pleural cavity is lined by a parietal pleura and filled with a thin layer of serous fluid. This fluid lets the lungs expand and contract thousands of times each day without friction damage to surrounding tissue. The same principle applies to the pericardial sac around the heart. The bony cage defines the cavity walls, the sternum anteriorly, the vertebral column posteriorly, and the ribs laterally. The diaphragm forms the muscular floor. At the top, the thoracic inlet is the opening through which the trachea, esophagus, and great vessels travel in and out of the chest. The conceptual anchor is the dorsal ventral split followed by the diaphragm split. The ventral cavity is divided by the diaphragm into the thoracic cavity above and the abdominopelvic cavity below. Lock in that scaffold and every organ in the trunk has a clear home. Question 4. Which organelle is primarily responsible for producing ATP in a eukaryotic cell? Your options are ribosome, B. lysosome, C. mitochondrion, D. Golgi apparatus. What's your answer? Commit to one before I continue. The correct answer is C. Mitochondrion. C is correct because mitochondria carry out cellular respiration on the inner membrane and matrix, producing the bulk of cellular ATP from glucose breakdown through the Krebs cycle and the electron transport chain. A is wrong because ribosomes assemble amino acids into proteins by reading messenger RNA. They do not generate cellular energy or participate directly in the production of adenosine triphosphate within the cell. B is wrong because lysosomes contain digestive enzymes that break down waste, old organelles, and ingested particles. They function as recycling centers, not as sites of cellular energy production through respiration. D is wrong because the Golgi apparatus modifies, sorts, and packages proteins for transport to other locations. It does not generate energy or carry out reactions that produce adenosine triphosphate molecules. The mitochondrion is the eukaryotic cell's dedicated energy factory. Understanding how it works and why it exists as a separate organelle is the key to answering any cell biology question involving ATP or cellular respiration. The mitochondrion has a double membrane. Inside, the Krebs cycle in the matrix strips electrons from pyruvate and loads them onto carrier molecules. Those electrons then travel through the electron transport chain on the inner membrane, pumping hydrogen ions to create a gradient that ATP synthase uses to build ATP. ATP production has 3 connected stages. Glycolysis in the cytoplasm splits glucose into pyruvate. The Krebs cycle breaks pyruvate down further, and the electron transport chain generates the bulk of ATP, roughly 30 to 36 molecules per glucose molecule. The common trap is confusing busy organelles with energy-producing ones. Ribosomes make proteins, lysosomes break down waste, the Golgi packages proteins, and the endoplasmic reticulum synthesizes lipids and proteins. None of them generates the bulk of ATP, only the mitochondrion does. Whenever a question mentions ATP, cellular respiration, or energy production, the answer is the mitochondrion, every time, regardless of which other organelle names appear in the options. Question 5. Which instrument is best for measuring the mass of a small object in a laboratory? Your options are A. Graduated cylinder, B. meter stick, C. thermometer, D. electronic balance. Pick one. Trust your gut. Here's your chance to test yourself. The correct answer is D. Electronic balance. D is correct because an electronic balance provides a digital readout of mass and is the standard laboratory instrument for measuring the mass of small objects quickly and accurately. A is wrong because A, graduated cylinder, measures liquid volume rather than the mass of solid or liquid objects in a laboratory. B is wrong because a meter stick measures linear length and cannot determine the mass of any object. C is wrong because a thermometer measures temperature, providing no information about how much mass an object has. When scientists need to measure the mass of a substance, they reach for the electronic balance, the standard laboratory instrument for this job. Understanding how it works and why it replaced older tools is the key concept here. Inside an electronic balance, the sample pan sits above a load cell or strain gauge. When an object is placed on the pan, the sensor converts the downward force into an electrical signal. and the microprocessor displays the mass directly. No manual calculation needed. Each measurable property has exactly one correct instrument. Mass goes to the electronic balance, volume to a graduated cylinder, temperature to a thermometer, and length to a ruler or meter stick. Matching the property to the right tool is the core skill being tested. To get an accurate reading, the balance must rest on a stable, level surface away from drafts. Always press tare to zero out the container's mass before adding your sample. The display then reports only the mass of the contents. The electronic balance measures mass quickly and precisely by sensing force and converting it electronically. On any measurement question, pair the property in the stem with the instrument designed for it, and the answer becomes straightforward. Question 6. A statement that can be verified through observation, measurement, or record is best classified as which of the following? Your options are A. Opinion, B. Bias, C. Fact, D. Misconception. Which would you go with? Lock it in before the reveal. The correct answer is C. Fact. C is correct because a fact is a statement that can be verified through observation, measurement, expert agreement, or record. The defining feature is verifiability, which separates facts from opinions, biases, and misconceptions in any text. A is wrong because an opinion expresses a belief, judgment, or preference and cannot be verified the same way a fact can. Two reasonable people could disagree on an opinion without one being objectively wrong. B is wrong because bias is a slant or preference that shapes how information is presented, often through word choice, selection of voices, or framing. Bias is not the same as a verifiable claim about the world. D is wrong because a misconception is a belief that is widely held but factually wrong. The defining feature is that it is mistaken, not that it can be verified through measurement or careful documentation. The single criterion that separates a fact from an opinion is verifiability. If a third party could in principle check a claim against the world and get a definite answer, the statement is a fact. If the claim rests on a feeling, judgment, or preference, no such check is possible. Verification operates through four methods: direct observation, measurement, expert consensus, and written record. A statement qualifies as a fact if any one of these methods could settle it, even if the test has not actually been run yet. The point is that a definite answer exists in principle. Facts and opinions are constantly blended in real text, often in the same sentence or paragraph. A claim like, "The hospital employs 300 nurses," can be checked against payroll records, making it a fact. The hospital is the best employer in the region depends on how best is defined, making it an opinion. Certain signal words flag which category a statement falls into. Words like verify, record, measure, count, date, and document point toward fact. Words like best, worst, should, beautiful, and troubling point toward opinion. Words like always, never, and nobody often signal a generalization that slides into opinion when it cannot be checked exhaustively. Ultimately, every fact versus opinion item comes down to one question. Could a third party check this claim and get a definite answer? That single test handles nearly every case the TEAs will present, and it applies equally to textbooks, news articles, and clinical guidelines you will read throughout your career. Question 7. What does the suffix ectomy mean as an appendectomy? Your options are A. Inflammation, B. Pain, C. Study of, D. Surgical removal. Don't overthink it. Which one feels right? The correct answer is D. Surgical removal. D is correct because the suffix ectomy means surgical removal. An appendectomy removes the appendix. A tonsillectomy removes the tonsils. and a hysterectomy removes the uterus. All surgical procedures involving excision. A is wrong because inflammation is the meaning of itis, as in appendicitis or arthritis. The ectomy suffix specifically refers to a surgical procedure removing tissue, not a disease state. B is wrong because pain is the meaning of algia, as in neuralgia or myalgia. The ectomy suffix names a surgical procedure rather than describing a symptom experienced by patients in clinical settings. C is wrong because study of is the meaning of ology, as in cardiology or biology. The ectomy suffix indicates a surgical procedure, not an academic field of study. Medical terminology is built on a small set of classical roots and suffixes inherited from ancient Greek and Latin. Once you learn the pattern, dozens of procedure names become readable on sight. 4 suffixes unlock the majority of medical vocabulary. The suffix ectomy means surgical removal, is means inflammation, algia means pain, and ology means study of. Each suffix carries exactly one meaning across the entire system. The construction is consistent. Take an organ root, attach a suffix, and the resulting term names the operational condition. Hyster plus ectomy gives hysterectomy. Append plus ectomy gives appendectomy. The combining logic stays constant even when a connecting vowel is dropped. The most common trap is confusing suffixes attached to the same root. Appendectomy and appendicitis share the same organ but mean entirely different things. Reading the suffix as carefully as the root is the core skill being tested. Medical terminology rewards pattern recognition over memorization. Master a core set of roots and suffixes, and nearly every procedural or pathological term you encounter becomes readable on first sight. On this exam and every clinical course that follows. Question 8. Which of the following directional terms means farther from the point of origin or attachment to the trunk? Your options are A. Proximal, B. Medial, C. Distal, D. Superficial. Got a guess? Lock it in. The correct answer is C. Distal. C is correct because distal means farther from the point of origin or attachment of a limb. The fingers are distal to the elbow and the toes are distal to the knee. A is wrong because proximal means closer to the trunk or point of origin, which is the direct opposite of distal in standard anatomical terminology. B is wrong because medial refers to a position closer to the midline of the body and does not describe distance from a point of origin. D is wrong because superficial means closer to the body surface, an entirely different directional term unrelated to distance from origin. Distal is a directional term meaning farther from a structure's point of origin or attachment. For limbs, that origin is where the limb meets the trunk, the shoulder for the upper limb, the hip for the lower limb. Moving down the arm, the elbow is distal to the shoulder, the wrist is distal to the elbow, and the fingertip is the most distal point of all. Each location is defined relative to another. Distal is always a relationship, never an absolute position. Anatomy uses paired directional terms because everyday words like above and below break down when a body changes position. Each pair covers one axis. Distal and proximal describe the limb axis. Superior and inferior describe vertical level. Anterior and posterior describe front to back. And medial and lateral describe side to side. Applying distal correctly means identifying the right origin for the structure in question. For limbs, the origin is the trunk attachment, but for the GI tract it is the mouth. And for renal tubules it is the glomerulus. Always locate the origin first, then ask which point is farther from it. A common trap is confusing distal with inferior. Both can be correct at the same time because they describe different axes. The key is to read the question stem for its reference point. Signal words like origin or trunk attachment call for the proximal distal pair. Words like above or below call for superior and inferior. Question 9. 3 students measure the mass of the same object and get readings clustered tightly near the true value. The measurements are best described as which of the following? Your options are A. Accurate only, B. Precise only, C. Neither accurate nor precise, D. Both accurate and precise. Which one is it? Pause the video if you need more time. The correct answer is D. Both accurate and precise. D is correct because readings clustered tightly together demonstrate precision, and being close to the true value demonstrates accuracy. So both qualities are present in these measurements. A is wrong because accuracy alone would not explain the tight clustering between repeated independent measurements observed by the students. B is wrong because precision alone would not describe how close the measurements fall to the actual true value of the object. C is wrong because the readings clearly demonstrate both clustering and closeness to the true value, satisfying both terms. Accuracy and precision are 2 distinct qualities that every measurement must be judged against separately. Understanding how they differ and why the difference matters is the key to diagnosing what's actually wrong when data looks off. The classic target analogy makes this concrete. Arrows clustered on the bullseye show both qualities. Arrows scattered but centered show accuracy without precision. Arrows tightly grouped but off-center show precision without accuracy. Arrows scattered and off-target show neither. Crucially, each quality points to a different kind of error. Inaccuracy reveals systematic error, a flaw baked into the instrument or procedure every single trial. Imprecision reveals random error, unpredictable variation between trials due to fluctuating conditions or technique. Train yourself to spot the signal words. Terms like clustered, consistent, and repeatable all point to precision. Phrases like close to the true value or matches the standard point to accuracy. When both sets of cues appear together, both qualities are present. Here's the deeper principle. Averaging multiple measurements can cancel random error and improve precision, but it cannot fix a systematic error. A scale reading 2 grams high will always average 2 grams high. Fixing accuracy requires recalibration against a known standard, a completely different correction. Question 10. Which sentence demonstrates a complex sentence structure? Your options are A. The nurse checked the IV. B. The nurse checked the IV and the doctor reviewed the chart. C. After the nurse checked the IV, the doctor reviewed the chart. D. The nurse checked the IV, the doctor reviewed the chart. Take a second. Which answer would you pick? The correct answer is C. After the nurse checked the IV, the doctor reviewed the chart. C is correct because a complex sentence has one independent clause and at least one dependent clause. After the nurse checked the IV is dependent, and the doctor reviewed the chart is independent, forming a complex sentence. A is wrong because the nurse checks the IV is a simple sentence containing one independent clause with no dependent clause attached. It does not meet the structural requirement for sentence complexity. B is wrong because 2 independent clauses join by and form a compound sentence, not a complex one. Complex sentences require at least one dependent clause to qualify under the standard definition. D is wrong because 2 independent clauses joined by a semicolon form a compound sentence. There is no dependent clause present, so the structure does not qualify as complex grammatically. Sentence structure isn't just grammar housekeeping, it carries meaning. Understanding how complex sentences work helps you both identify them on exams and use them more deliberately in your writing. A complex sentence has exactly one independent clause and at least one dependent clause. The independent clause expresses a complete thought on its own. The dependent clause has a subject and verb too. but a subordinating conjunction or relative pronoun makes it grammatically incomplete. Take the sentence, after the nurse checked the IV, the doctor reviewed the chart. The word after is the subordinating conjunction. It attaches to the first clause and blocks it from standing alone. The second clause stands on its own. Together they form a complex sentence with one main idea and one supporting idea. English categorizes sentences into 4 structures: simple, compound, complex, and compound complex. Each structure signals a different relationship between ideas. A compound sentence joins 2 equal ideas. A complex sentence subordinates one idea to another, showing which is the main point and which is the qualifier. The fastest way to classify any sentence is to read it as 2 pieces and ask whether each could stand alone. If both could, it's compound. If only one could, it's complex. If there's only one piece, it's simple. This 2-step test handles every sentence structure question without memorizing extra rules. Question 11. Which of the following is the best definition of a topic? Your options are A. The deeper abstract idea of a passage. B. What a passage is about, stated as a phrase. C. The most important point in a complete sentence. D. The support offered for a claim. Before I reveal it, which one do you think is right? The correct answer is B. What a passage is about, stated as a phrase. B is correct because a topic is what a passage is about, expressed as a phrase rather than a full sentence. The main idea is the most important point about the topic, while theme is the deeper, more abstract idea. A is wrong because a deeper, more abstract idea describes theme rather than topic. Themes are common in fiction and are expressed as broader concepts like sacrifice or perseverance, not as the simple subject phrase of a passage. C is wrong because the most important point stated in a complete sentence is the main idea, not the topic. The main idea makes a claim about the topic. The topic is just the subject of the writing. D is wrong because support for a claim describes evidence in an argument. Evidence backs up the claim with facts, statistics, or examples. The topic is simply the subject of the passage rather than support. When a reading question asks about a passage, it's targeting one of 3 distinct layers of meaning: topic, main idea, or theme. These terms are not interchangeable, and confusing them is the most common source of wrong answers on passage-level questions. Topic is just the subject, a noun phrase with no verb and no assertion. Main idea is the claim the passage makes about that subject. Theme is the deeper, abstract human concept the writing illuminates. The same passage can produce all 3 answers. A passage on hand washing has the topic hand washing in hospitals, a main idea like hand washing reduces infection rates, and a theme like the gap between best practice and routine behavior. Identifying a topic rests on one test. Ask what the writing is about, then check your answer. If a verb sneaks in, you've crossed into main idea territory. If the answer turns abstract and broad, you've drifted into theme territory. Reading the question stem carefully is half the work. Words like about or subject of signal a topic question. Main point or central claim pull toward main idea. Underlying message or deeper meaning pull toward theme. Match the stem to the right layer and the correct answer becomes much easier to spot. Question 12. A blood gas report shows that most of the carbon dioxide in venous blood is being carried in which form? Your options are A. Dissolved carbon dioxide gas. B. Bound directly to oxygen molecules. C. Carbaminohemoglobin. D. Bicarbonate ions in plasma. What's your answer? Commit to one before I continue. The correct answer is D. Bicarbonate ions in plasma. D is correct because about 70% of carbon dioxide in blood is carried as bicarbonate ions dissolved in plasma. Smaller amounts travel bound to hemoglobin or dissolve directly as carbon dioxide gas. A is wrong because only about 7% of carbon dioxide is carried dissolved as gas in plasma, far less than the bicarbonate fraction in venous transport. B is wrong because carbon dioxide does not bind directly to oxygen molecules. It binds hemoglobin separately at amino groups, not to oxygen itself. C is wrong because carbaminohemoglobin accounts for about 23% of carbon dioxide transport, less than the dominant bicarbonate ion fraction in plasma. Most carbon dioxide in venous blood doesn't travel as free gas. It's transformed into other forms that plasma can carry far more efficiently. Understanding those forms and why they exist unlocks both respiratory physiology and acid-base chemistry. Carbon dioxide is carried three ways, roughly 70%, as bicarbonate dissolved in plasma, 23% bound to hemoglobin as carbaminohemoglobin, and only 7% as free dissolved gas. Bicarbonate dominates by a wide margin, a fact worth anchoring firmly in memory. Inside red blood cells, the enzyme carbonic anhydrase combines carbon dioxide with water to form carbonic acid, which instantly splits into a hydrogen ion and bicarbonate. The bicarbonate exits into plasma as chloride enters, the chloride shift, while hemoglobin buffers the remaining hydrogen ion. Carbon dioxide gas is only modestly soluble in water. High exercise volumes would saturate plasma instantly. Converting it to bicarbonate, a charged species, multiplies effective solubility enormously. As a bonus, the bicarbonate carbonic acid pair is the body's primary buffer keeping plasma pH in its narrow physiological range. The whole system reverses at the lungs. Bicarbonate re-enters red blood cells, recombines with hydrogen, and releases carbon dioxide to be exhaled. Remember 70, 23, and 7, and remember that carbon dioxide transport and acid-base balance are two sides of the same coin. Question 13. Which structure of the respiratory system is the actual site of gas exchange between air and blood? Your options are or trachea, B. alveoli, C. bronchi, D. bronchioles. Pick one. Trust your gut. Here's your chance to test yourself. The correct answer is B. Alveoli. B is correct because alveoli are tiny sacs surrounded by capillaries with walls 1 cell thick. Oxygen and carbon dioxide diffuse across this thin barrier, making alveoli the true site of pulmonary gas exchange. A is wrong because the trachea is a conducting airway that warms and channels air to the bronchi, but does not participate in gas exchange itself. C is wrong because the bronchi are conducting passages that branch from the trachea into each lung, but lack the thin walls needed for gas exchange. D is wrong because bronchioles are smaller, conducting airways leading to alveoli. They channel air but do not perform actual gas exchange. The alveoli are the sites of gas exchange in the lungs, tiny, balloon-like sacs clustered at the ends of the smallest airways. Understanding why they are built the way they are reveals the physics driving every breath you take. Each lung contains roughly 300 million alveoli, creating a combined surface area of about 70 square meters. Their walls are only half a micrometer thick and are pressed directly against a dense mesh of capillaries, a design that makes diffusion as fast as possible. Oxygen diffuses from the alveolus into the blood because its partial pressure is higher in the airspace than in the incoming blood. Carbon dioxide moves the other way for the same reason. Both gases cross the fused epithelial and endothelial layers in a fraction of a second. The lung separates two jobs: the conducting zone, tracheae, bronchi, and bronchioles, filters, warms, and humidifies air but performs no gas exchange. Its walls are too thick and its surface too small. Gas exchange happens only in the respiratory zone, at the alveoli, where walls are thinnest and surface area is greatest. When you see signal words like diffusion, oxygen, carbon dioxide, thin wall, or surface area, the answer points to the alveoli. Words like cilia, mucus, warming, or filtering point to the conducting airways upstream, a fundamentally different part of the respiratory system. Question 14. Which subatomic particle carries a negative charge? Your options are A. Proton, B. Neutron, C. Nucleus, D. Electron. Which would you go with? Lock it in before the reveal. The correct answer is D. Electron. D is correct because electrons carry a negative charge of 1 and orbit the nucleus in shells. They have very small mass relative to protons and neutrons, and their movement governs the chemical bonding behaviors of any atom. A is wrong because protons carry a positive charge of 1 and reside in the nucleus. The number of protons defines the atomic number and determines which element the atom represents. B is wrong because neutrons carry no electrical charge. They are located in the nucleus along with protons and contribute to the atom's mass number, but not to its overall electrical charge. C is wrong because the nucleus is not a subatomic particle. The nucleus is the dense central region of the atom that contains the positively charged protons and uncharged neutrons together. The electron is the negatively charged subatomic particle, and understanding it unlocks almost everything in basic chemistry. Let's look at what makes electrons so central to how atoms behave. Electrons carry a single negative charge and have a mass about 1/1800th that of a proton or neutron. They occupy the electron cloud surrounding the nucleus, and they are the smallest of the 3 common subatomic particles. Picture a Bohr model of sodium, 11 protons in the nucleus, surrounded by 3 shells holding 2, 8, and 1 electron. That lone outer electron is loosely held and easily lost, which is exactly why sodium is so reactive. Atoms react to achieve a stable valence shell, usually 8 electron, the octet rule. They do this by sharing electrons in covalent bonds, losing electrons to become positive Cartians, or gaining electrons to become negative anions. Keep these signal words clear. Electron means negative charge. Proton means positive charge. Neutron means neutral. And nucleus is a structure inside the atom, not a subatomic particle itself. Electron mass is negligible, so atomic mass comes almost entirely from protons and neutrons. Question 15. Which tool is most appropriate for measuring a precise volume of liquid? Your options are A. Beaker, B. Graduated cylinder, C. Erlenmeyer flask, D. Test tube. Don't overthink it. Which one feels right? The correct answer is B. Graduated cylinder. B is correct because a graduated cylinder is designed with fine markings along its length, making it the standard laboratory tool for measuring precise liquid volumes accurately. A is wrong because beakers have widely spaced markings intended for rough volume estimates rather than precise measurements of liquid contents. C is wrong because Erlenmeyer flasks, like beakers, are made for mixing and approximate volume rather than precise measurement. D is wrong because test tubes do not contain volume markings designed for accurate measurement of liquids. When a lab experiment demands an accurate volume of liquid, the graduated cylinder is the go-to tool. Its tall, narrow shape is the key to its precision. A small change in volume produces a visible change in liquid height, making the fine markings easy to read. Not all glassware is equal. Beakers and Erlenmeyer flasks are convenient for pouring but only give rough estimates. A graduated cylinder trades some convenience for finer markings and narrow geometry. Volumetric flasks and pipettes are even more precise, but only for a single fixed volume each. Because water clings to glass, the liquid surface forms a curved meniscus, concave in the center. The correct reading is always taken from the bottom of that curve, with your eye level even with the meniscus. Reading from above or below introduces parallax error and can shift the result by several %. 3 technique rules ensure the cylinder reaches its full precision. Hold your eye level with the meniscus, read from the bottom of the curve, and always place the cylinder on a perfectly level surface. Neglecting any one of these can make a precise tool perform no better than a beaker. Precision in lab work comes from 2 things together: choosing the right tool and using it correctly. The graduated cylinder sets the upper limit on accuracy. Your reading technique determines whether you actually reach it. Question 16. An inference is best defined as which of the following? Your options are A. A logical conclusion drawn from textual evidence. B. A guess based on personal feelings. C. A statement copied directly from the text. D. A fact stated in the first sentence. Got a guess? Lock it in. The correct answer is A. A logical conclusion drawn from textual evidence. A is correct because an inference is a logical conclusion drawn from evidence in the text and reasoning, not stated outright by the author. The reader supplies the connection, while the text supplies the supporting evidence for that step. B is wrong because guessing from personal feelings is not inference. A sound inference must be anchored to specific evidence in the passage, not to the reader's own emotional reaction or unrelated personal beliefs about the topic. C is wrong because a statement copied directly from the text is a quotation, not an inference. Inferences go beyond what is explicitly stated, drawing conclusions the author has implied through specific details in the passage. D is wrong because a fact stated in the first sentence is just a stated fact. An inference is unstated and must be reasoned out from clues. Direct statements of fact require no inferential reasoning at all. An inference is a logical conclusion that goes beyond what a text explicitly states. It's the bridge between what an author writes and what they imply. It's more than a guess, but it's never simply a restatement of the text. Every sound inference follows 2 steps. First, locate the specific phrase or pattern the author actually wrote. Second, apply reasoning to reach a conclusion the author left unstated. Skip the evidence and it's a guess. Skip the reasoning and it's just a paraphrase. Exam writers always build the same 4-option trap. One choice is pure speculation. One merely restates the text. One contradicts it outright. And one sits in the inference zone, grounded in textual clues and extended by reasoning. Your job is to identify that 4th option every time. Think of a passage describing a clinic's high turnover, low pay and resignations. The text never says the clinic is in crisis, but reasoning from those clues leads to the defensible conclusion that it risks operational failure. That middle zone between paraphrase and speculation is exactly where inference lives. The wording of an inference question is itself a clue. Words like infer, suggest, and indicate signal you need the inference zone. Words like state or directly say point toward literal comprehension. And predict tips into speculation unless the passage gives you the building blocks to support it. Question 17. What does the root cardio mean? Your options are A. Lung, B. Stomach, C. Heart, D. Kidney. Which one is it? Pause the video if you need more time. The correct answer is C. Heart. C is correct because the root cardio comes from Greek and means heart. It appears in many medical terms including cardiology, cardiovascular, and electrocardiogram, all referring to the heart or its electrical functions. A is wrong because lung corresponds to the roots pulm or pneuma, as in pulmonary or pneumonia. These describe the respiratory system rather than the cardiac structures and functions. B is wrong because stomach corresponds to the root gastro, as in gastritis or gastroenterology. The cardio root is reserved for words referring specifically to the heart and its workings. D is wrong because kidney corresponds to the root nephro or renal, as in nephrology or nephrectomy. These roots describe the urinary system, not cardiac anatomy or function. The root cardio comes from the Greek word cardia, meaning heart. It appears in dozens of medical terms, and wherever you see it, the heart is always involved. Understanding this root unlocks a whole family of clinical vocabulary. Medical words are modular. Cardio combines with suffixes to build precise terms. Cardiology is the study of the heart. Cardiomegaly means an enlarged heart, and cardiomyopathy means disease of the heart muscle. The same suffix rules apply across nearly all medical compound words. The most common trap is confusing cardio with similar sounding roots. Cranio means skull, pulmono means lung, and gastro means stomach. Each root names exactly one body part. Exam writers deliberately place these look-alike roots together to test whether you recognize cardio specifically. Medical terminology is overwhelmingly Greek and Latin because ancient physicians like Hippocrates wrote the first systematic Western medical texts in those languages. When medicine standardized in the modern era, those roots became the backbone of the field. Roughly 150 roots cover almost every term in use today. Whenever cardio appears in a term, the heart is involved, no exceptions. Learn roots in body system clusters rather than in isolation. And the vocabulary stops being something to memorize and starts being something you can simply read. Question 18. Which muscle is the primary muscle responsible for inhalation during quiet breathing? Your options are A. Diaphragm, B. Pectoralis major, C. Latissimus dorsi, D. Sternocleidomastoid. Take a second. Which answer would you pick? The correct answer is A. Diaphragm. A is correct because the diaphragm is the dome-shaped main muscle of breathing. When it contracts, it flattens, expanding the thoracic cavity and lowering pressure so air rushes into the lungs. B is wrong because the pectoralis major is a chest muscle used for arm movement. It can be an accessory muscle but is not the primary breathing muscle. C is wrong because the latissimus dorsi is a broad back muscle that moves the arm. It does not function as the main muscle of inspiration. D is wrong because the sternocleidomastoid rotates and flexes the head and acts only as an accessory muscle of breathing during forceful inspiration. The diaphragm is the primary muscle of quiet breathing, a dome-shaped muscle forming the floor of the thoracic cavity. Understanding how it works means understanding the physics of pressure and volume, and knowing exactly which muscles do what during each phase of the breath. The phrenic nerve, arising from cervical levels C3, C4, and C5, travels down through the thorax to innervate the diaphragm from below. The mnemonic is simple. C3, 4, 5 keeps the diaphragm alive. High cervical injuries can paralyze the diaphragm entirely, requiring ventilator support, while lower spinal injuries leave breathing intact. When the diaphragm contracts, it flattens downward, expanding the thoracic cavity in 3 dimensions. By Boyle's law, this increased volume drops intrapulmonary pressure below atmospheric pressure, and air rushes in to equalize the difference. Inhalation is active and muscle-driven. The diaphragm alone accounts for about 75% of the volume change in tidal breathing. Intercostal muscles assist by elevating the rib cage. Accessory muscles like the scalens and sternocleidomastoid only engage during forceful or labored inspiration. They stay quiet during normal breathing. Quiet exhalation requires no muscle effort. The lungs and chest walls simply recoil elastically, raising pressure and pushing air out. Only forced exhalation recruits abdominal muscles. Knowing which phase a question describes, and whether breathing is quiet or labored, point you directly to the correct muscle group. Question 19. In a DNA molecule, which nitrogenous base pairs with adenine? Your options are A. B. Guanine, C. Thymine, D. Uracil. Before I reveal it, which one do you think is right? The correct answer is C. Thymine. C is correct because in DNA, adenine always pairs with thymine through 2 hydrogen bonds. This complementary base pairing rule maintains the consistent width of the double helix and ensures faithful replication of genetic material during cell division. A is wrong because cytosine pairs with guanine, forming 3 hydrogen bonds. Cytosine and guanine are partners, not adenine and cytosine, so this base pairing combination does not occur in DNA. B is wrong because guanine pairs with cytosine in DNA. Guanine is a purine that bonds with the pyrimidine cytosine through 3 hydrogen bonds, not with adenine in the helix. D is wrong because uracil is found in RNA, not DNA. Uracil pairs with adenine during transcription, but DNA uses thymine as the complementary base for adenine in the double helix. Complementary base pairing is the structural rule that holds the DNA double helix together and makes heredity possible. Every base pair follows the same chemistry in every organism on Earth. Adenine always pairs with thymine, linked by 2 hydrogen bonds. Cytosine always pairs with guanine, linked by 3 hydrogen bonds. These are the only permitted pairings in double-stranded DNA. The rigidity of base pairing traces to molecular geometry. Purines have 2 fused rings and pyrimidines have 1. So pairing 1 of each keeps the helix width perfectly uniform. 2 purines would bulge it, 2 pyrimidines would constrict it. The precise match of hydrogen bond donor and acceptor positions locks each pair in place. Adenine and thymine fit each other's geometry exactly, as do cytosine and guanine. No other combination satisfies both the hydrogen bond pattern and the ring size constraint. The most common exam trap is uracil. Uracil pairs with adenine, but only in RNA. DNA exclusively uses thymine. Keeping this distinction clear is the difference between a correct and an incorrect answer on any base pairing question. Question 20. When reading a graduated cylinder filled with water, the measurement should be taken at which point? Your options are A. Top of the meniscus, B. Bottom of the meniscus, C. Side of the cylinder, D. Top of the rim. What's your answer? Commit to one before I continue. The correct answer is B. Bottom of the meniscus. B is correct because for water and most clear liquids, the curved surface forms a downward dip. So the proper reading is taken from the bottom of the meniscus at eye level. A is wrong because reading at the top of the meniscus consistently overestimates the actual liquid volume in the cylinder. C is wrong because the side of the cylinder is not where liquid level is measured during routine volume readings. D is wrong because the rim is far above the actual liquid surface and provides no useful measurement. When you pour water into a graduated cylinder, the surface doesn't stay flat. It curves into a shape called the meniscus. Understanding why this happens and where to read it is one of the most fundamental habits in lab measurement. Water clings to glass and curves downward, a concave meniscus. Mercury pulls away from glass and curves upward, a convex meniscus. The shape tells you which force is dominant: adhesion for water, cohesion for mercury. Cohesion is the pull between liquid molecules themselves, while adhesion is the pull between liquid and glass. When adhesion wins, the liquid climbs the wall and curves down. When cohesion wins, the liquid retreats from the wall and curves up. The meniscus shape is a direct readout of which force dominates. The correct technique has 3 parts. Position your eye at meniscus level. Read from the lowest point of the curve, and never read from the top or from above. Reading from above overstates the volume because your eye catches the higher curved edge instead of the true bottom. For water and most aqueous solutions in glass, always read the bottom of the meniscus with your eye level even with the surface. Small measurement habits like this prevent errors that compound through every calculation that follows. Question 21. When the new policy passed, the hospital administration sent a celebratory email to all staff praising the streamlined scheduling system. Within 2 weeks, the night shift nurses had circulated a petition asking for revisions. Several nurses had already given notice. Hospital leadership has so far declined to comment beyond saying that adjustments are always part of any new system. The author's attitude toward the new scheduling system is best described as which of the following? Your options are A. Enthusiastic, B. Neutral, C. Confused, D. Critical. Pick one. Trust your gut. Here's your chance to test yourself. The correct answer is D. Critical. D is correct because the author distances themselves from the celebratory framing, describes resignations and a petition, and notes leadership refusing to engage. These choices together signal disapproval rather than support, neutrality, or confusion about the policy. A is wrong because an enthusiastic author would emphasize the policy's benefits and adopt the administration's positive framing without distance. The passage instead foregrounds harms and quotes the administration with apparent skepticism. B is wrong because a neutral author presents both sides without revealing a stance. This passage selects only negative effects and signals disapproval through its details, which is not balanced reporting on the new policy. C is wrong because the author presents a clear, ordered chain of cause and effect. There is no sign of confusion. The passage is too organized and pointed to be the work of a confused observer. Author's attitude is the writer's emotional or evaluative position toward a subject. And it's almost never spelled out directly. Instead, it leaks through the text in specific, detectable ways. 4 signals carry attitude most reliably: word choice, selection of evidence, distancing language like claimed or alleged, and endorsing language like impressive or effective. None of these requires the writer to state a verdict outright. Imagine a passage about a hospital scheduling system. The author quotes one celebratory email but spends most of the text on resignations, a petition, and a refusal to engage. The cumulative effect is critical, even though the word bad never appears. Selection of detail is doing all the work. On exam items, attitude options cluster into 4 zones: enthusiastic or admiring, neutral or balanced, critical or skeptical, and confused or uncertain. Confused rarely fits a tightly written passage and is usually a trap. The real trap is choosing neutral when the text quietly leans critical through detail alone. Reading for attitude means tracking both layers together: the vocabulary a writer chooses and the facts a writer selects. When those 2 signals align, the stance is clear, even if the writer never names it. Question 22. Which of the following is the SI base unit for length? Your options are A. Gram, B. Liter, C. Meter, D. Second. Which would you go with? Lock it in before the reveal. The correct answer is C. Meter. C is correct because the meter is the official SI base unit used to measure length, distance, or height in scientific work and is the foundation of metric length conversions. A is wrong because the gram is the base unit used to measure mass of an object, not its length or distance. B is wrong because the leader measures volume of liquids and gases, not the length or distance between 2 points. D is wrong because the second is the SI base unit for time intervals, not for measuring physical length. The SI system, short for System International, is the modern metric system used in scientific work worldwide. It defines 7 base units, each tied to a single fundamental quantity. Every other unit in science is built from combinations of these 7. The 7 base units are the meter for length, the kilogram for mass, the second for time, the Kelvin for temperature, the ampere for electric current, the mole for amount of substance, and the candela for luminous intensity. Memorizing each unit alongside its quantity is the core skill tested on SI questions. The meter is defined by the speed of light. 1 meter is exactly the distance light travels in a vacuum in 1/299 millionth of a second. This definition is so precise that any well-equipped laboratory on Earth can reproduce it independently. From the meter, prefixes scale up and down by powers of 10. A kilometer is 1,000 meters, a centimeter is 1/100th, a millimeter is 1,000th, and a nanometer is 1/1000th. This decimal scaling is the metric system's defining feature and makes unit conversions far simpler than imperial equivalents. When an exam question names a fundamental quantity like length, mass, or time, you simply match it to its SI base unit. If you know all 7 pairings, no distractor unit on the option list can trip you up. Question 23. A patient is lying flat on the back facing upward. Which plane would divide this patient into superior and inferior portions? Your options are A. Transverse plane, B. Sagittal plane, C. Frontal plane, D. Mid-sagittal plane. Don't overthink it. Which one feels right? The correct answer is A. Transverse plane. A is correct because the transverse, or horizontal, plane divides the body into superior, upper, and inferior lower portions. A computed tomography slice provides a transverse view of the body. B is wrong because the sagittal plane is a vertical cut that divides the body into left and right portions, not superior and inferior portions. C is wrong because the frontal or coronal plane divides the body into anterior front and posterior back portions, not superior and inferior. D is wrong because the mid-sagittal plane is a vertical cut down the midline producing equal left and right halves, not superior and inferior portions. Anatomy organizes the body around 3 standard reference planes, giving clinicians and surgeons a shared spatial language. Without these planes, describing a lesion's location would be ambiguous and potentially dangerous. Let's see how each plane works and what makes them distinct. The transverse plane is horizontal, slicing the body into superior and inferior portions, like a CT scanner taking a cross-section at the waist. The sagittal plane is vertical front to back, dividing left from right. The frontal or coronal plane is also vertical, but runs side to side, separating anterior from posterior. The key to avoiding confusion is anchoring each plane to its specific division. Transverse divides superior from inferior. Sagittal divides left from right. Frontal divides anterior from posterior. Knowing these pairings protects you from the classic exam trap of mixing up a plane's orientation with its actual cut. A CT scan is the real-world transverse plane in action. Each image is one horizontal slice at a chosen vertical level. Radiologists scroll through these slices to reconstruct a 3-dimensional picture, and the consistent transverse orientation is what makes that mental model reliable. When you see signal words like horizontal cut, upper and lower halves, or CT slice, think transverse plane. Picture a flat sheet passing through the body and ask which 2 portions remain. That question always leads you to the right answer. Question 24. When copper metal is placed in silver nitrate solution and silver coats the copper, what type of reaction has occurred? Your options are A. Synthesis, B. Single replacement, C. Decomposition, D. Double replacement. Got a guess? Lock it in. The correct answer is B. Single replacement. B is correct because a single replacement reaction occurs when one element displaces another from a compound. Copper replaces silver in the nitrate compound, freeing solid silver metal and forming copper nitrate solution as the reaction proceeds. A is wrong because synthesis reactions combine two or more reactants into a single product. The copper and silver nitrate reaction produces multiple products, not just one larger combined compound from the reactants. C is wrong because decomposition reactions involve a single compound breaking into two or more simpler substances. Here the reactants include both an element and a compound, not a single decomposing compound by itself. D is wrong because double replacement reactions involve two compounds exchanging partners. Here a free element copper reacts with a compound, indicating a single replacement instead of a double replacement reaction. A single replacement reaction follows a simple but powerful pattern. One element displaces another from a compound, forming a new compound and releasing a free element. Understanding why this happens requires looking at reactivity and electron transfer. The reaction is driven by electron transfer. The more reactive element surrenders or captures electrons more readily, taking the place of the less reactive element in the compound. If the incoming element is less reactive, nothing happens at all. The classic example is copper wire placed in silver nitrate solution. Copper, higher in the activity series than silver, displaces silver from the compound. Silver crystals coat the wire while copper ions turn the solution blue. Chemistry you can watch in real time. Single replacement is one of four fundamental reaction types. Synthesis combines reactants into one product. Decomposition splits one compound into parts. Single replacement swaps one element into a compound. Double replacement has two compounds exchanging partners. Recognizing the structural pattern is the key to telling them apart. Signal words like displaces, replaces, or activity series point directly to single replacement. The same principle powers real-world applications, from extracting metals out of ores to galvanizing steel with zinc to protect against corrosion. Question 25. The metric prefix kilo represents which value? Your options are A. 1000, B. 100, C. 1/10, D. 1000. Which one is it? Pause the video if you need more time. The correct answer is A. 1000. A is correct because the prefix kilo means 1000. So 1 kilogram equals 1000 grams and 1 kilometer equals 1000 meters in the metric system. B is wrong because 100 corresponds to the prefix hecto, not kilo, in the standard metric prefix system. C is wrong because 1/10 corresponds to the prefix deci, used for smaller subdivisions of base units. D is wrong because 1000th corresponds to the prefix milli, which describes a much smaller scale than kilo. The metric prefix kilo means exactly 1000 watt and T, and that single fact unlocks a whole system built on powers of 10. Understanding why the metric system works this way makes unit conversion far simpler than any imperial calculation. The prefix attaches to any base unit and scales it by 1000, every time, without exception. A kilogram is 1000 grams, a kilometer is 1000 meters, and so on across every quantity the metric system measures. The full prefix family scales up and down in consistent steps of 3 powers of 10. Kilo, mega, giga, and tera climb above the base unit, while milli, micro, nano, and pico descend below it, each step multiplying or dividing by 1000. The most common exam traps pair prefixes that sound similar but differ by a factor of 10 or 1,000. Kilo and hecto both sound large, but hecto is only 100. Milli and micro both sound small, but micro is 1,000 times smaller than milli. Storing each prefix as its exact power of 10 turns every unit conversion into a simple decimal shift. Master the 8 core pairings. From nano to tera, and metric arithmetic becomes routine. Question 26. To take a manual blood pressure reading, position the patient with their arm at heart level. Wrap the deflated cuff snugly around the upper arm, with the lower edge about an inch above the bend of the elbow. Locate the brachial pulse just above the inside of the elbow. Place the stethoscope's diaphragm over the brachial pulse but not under the cuff. Close the valve on the bulb and inflate the cuff to about 30 above the patient's expected systolic pressure. Slowly open the valve to release pressure. According to the directions, what should be done immediately after locating the brachial pulse? Your options are A. Inflate the cuff. B. Open the valve. C. Place the stethoscope's diaphragm over the pulse. D. Record the numbers. Take a second. Which answer would you pick? The correct answer is C. Place the stethoscope's diaphragm over the pulse. C is correct because the directions follow this order. Locate the brachial pulse. Then place the stethoscope's diaphragm over the pulse but not under the cuff. The next step in sequence after locating the pulse is placing the stethoscope. A is wrong because inflating the cuff comes after closing the valve, which itself comes after placing the stethoscope. The directions clearly separate locating the pulse from inflation by an intervening stethoscope placement step. B is wrong because opening the valve happens after the cuff has been inflated. The order is inflate, then slowly open the valve. Opening the valve does not directly follow locating the brachial pulse in the directions. D is wrong because recording numbers occurs at the very end of the procedure, after both the systolic and diastolic readings have been identified. It does not directly follow locating the brachial pulse in the sequence at all. Procedural passages test a specific skill, tracking the exact order of steps. Understanding sequence means knowing not just what to do, but when, and being able to identify which step comes immediately before or after any given point in a procedure. Consider manual blood pressure measurement. The steps must happen in a fixed order. Locating the brachial pulse comes before placing the stethoscope, and inflating the cuff comes after. Skipping or swapping steps produces a useless result, which is exactly why order encodes the practical logic of the task. Procedural passages signal order through a small set of textual cues. Temporal adverbs like next and then mark the immediate next step. Comparative phrases like after the cuff is inflated anchor a step relative to another. Words like finally point to the end while first and initially point to the start. The most common trap is choosing a step that appears later in the procedure but is not the immediate next one. Exam writers fill wrong answers with real steps from the sequence, just in the wrong position. The correction is to count exactly one step away from the reference point named in the question. The most reliable technique is to mentally number each step as you read, even when the passage uses no numbers. A silent label 1, 2, 3 builds a clean index of the procedure. That index makes any sequence question straightforward to answer in testing and in clinical practice. Question 27. Which sentence has correct subject-verb agreement? Your options are the bag of medications are on the counter. B. The bag of medications were on the counter. Sir, the bag of medications have been moved. D. The bag of medications is on the counter. Before I reveal it, which one do you think is right? The correct answer is D. The bag of medications is on the counter. D is correct because the subject is bag, which is singular, so the verb must be singular. The phrase of medications is a prepositional phrase between subject and verb that does not change agreement requirements. A is wrong because R is plural, but the actual subject is bag, a singular noun. The plural noun medications appears in a prepositional phrase and does not control verb agreement here. B is wrong because were is plural past tense, but the singular subject bag requires a singular verb. The intervening prepositional phrase of medications cannot determine the verb form chosen. C is wrong because have is plural, but the subject bag is singular. Verbs agree with the grammatical subject, not with nearby plural nouns located inside intervening prepositional phrases. Subject-verb agreement is one of the most fundamental rules in English grammar, and one of the most heavily tested. The core principle is simple. A verb must match its subject in number. But identifying the true subject is where most writers go wrong. A singular subject takes a singular verb, and a plural subject takes a plural verb. The critical skill is ignoring any nouns that appear between the subject and the verb. Those intervening words do not change the agreement. Consider the sentence, the bag of medications is on the counter. The true subject is bag, singular. The phrase of medications is just a prepositional modifier. Strip it out and you're left with the bag is, which is correctly singular. The technique has 3 steps. First, locate the noun or pronoun performing the action. Second, strip out any prepositional phrases sitting between the subject and the verb. Third, check whether the verb form matches the bare subject that remains. 4 patterns appear most often on exams. Prepositional phrases like of nurses or of the doctors, collective nouns like team or committee, indefinite pronouns like each and every one, and compound subjects joined by and or or. In every case, isolate the true head noun first. The rest is just noise. Question 28. Which structure prevents food and liquids from entering the airway during the act of swallowing? Your options are A. Pharynx, B. Larynx, C. Epiglottis, D. Soft palate. What's your answer? Commit to one before I continue. The correct answer is C. Epiglottis. C is correct because the epiglottis is a flap of cartilage that folds down over the laryngeal opening during swallowing, directing food and liquid into the esophagus and protecting the airway from aspiration. A is wrong because the pharynx is the shared throat passage for both food and air. It does not actively close off the airway during swallowing. B is wrong because the larynx is the voice box that houses the vocal cords. It is the structure being protected, not the protector itself. D is wrong because the soft palate elevates to seal off the nasopharynx during swallowing, not the lower airway leading to the lungs. The epiglottis is a leaf-shaped flap of cartilage sitting at the top of the larynx. Its entire purpose is to prevent food and liquid from entering the airway every time you swallow. When food reaches the back of the throat, the epiglottis flips down like a trapdoor over the glottis, the opening to the trachea, sealing the airway and directing food into the esophagus instead. Once the swallow is complete, it springs back up and breathing resumes. The swallow reflex is a coordinated sequence. The soft palate rises to seal off the nasal cavity. The epiglottis folds down over the laryngeal inlet, and the vocal cords adduct as a second line of defense. The entire sequence takes only about 1 second. Several nearby structures all participate in swallowing, so it is easy to confuse them. The pharynx is the shared passage for air and food, but does not close the airway. The larynx is the structure being protected. The soft palate seals the upper nasal passage. Only the epiglottis seals the lower airway. When the epiglottis fails, after a stroke, in advanced dementia, or with muscular disease, food silently enters the lungs, leading to aspiration pneumonia. Recognizing this anatomy is the foundation for safe swallowing assessment and diet management in clinical practice. Question 29. An organism with two different alleles for a single gene is described as which of the following? Your options are A. Heterozygous, B. Homozygous dominant, C. Homozygous recessive, D. Homozygous. Pick one. Trust your gut. Here's your chance to test yourself. The correct answer is A. Heterozygous. A is correct because heterozygous means an individual carries two different alleles for the same gene, such as BB. The dominant allele typically masks the recessive allele in the resulting phenotype unless inheritance is incomplete or codominant in nature. B is wrong because homozygous dominant means an individual has two identical dominant alleles, such as BB. Both alleles are the same, not different, so this term does not apply to the question. C is wrong because homozygous recessive means an individual has two identical recessive alleles, such as EB. The two alleles match, so this is not the correct description for an organism with differing alleles. D is wrong because homozygous refers to having only one allele for a gene, often seen for X-linked genes in males. It does not describe an individual with two differing alleles for the gene. Understanding how allele combinations are named is the foundation of Mendelian genetics. Whether an organism carries matching or different alleles at a gene locus determines both its genotype and what traits it can pass to offspring. There are three diploid genotype categories to keep straight: heterozygous, homozygous dominant, and homozygous recessive. A fourth term, homozygous, means only one allele is present, typical of X-linked genes in males, and does not mean two different alleles. When two heterozygous parents cross, the Punnett square reveals a 1-to-1 genotype ratio, 1 BB, 2 B, and 1 BB. In complete dominance, the dominant allele masks the recessive one in BB individuals, producing a 3-to-1 phenotype ratio. A heterozygous organism displays the dominant phenotype, making it indistinguishable by appearance from a homozygous dominant individual. Crucially, it silently carries the recessive allele and can pass it to offspring, which is why carriers are central to autosomal recessive conditions like cystic fibrosis. The signal words are simple. Two identical alleles means homozygous, two different alleles means heterozygous, and only one allele means homozygous. The visible trait alone cannot tell you whether an organism is BB or BB. You need to know the genotype underneath. Question 30. A scale repeatedly gives the same mouse reading, but the reading is far from the true value. The scale is best described as which of the following? Your options are A. Accurate but not precise, B. Both accurate and precise, C. Neither accurate nor precise, D. Precise but not accurate. Which would you go with? Lock it in before the reveal. The correct answer is D. Precise but not accurate. D is correct because precision describes consistency among repeated readings, while accuracy describes closeness to the true value. So consistent but off-target readings are precise yet inaccurate. A is wrong because accuracy requires closeness to the true value, which the scale fails to achieve in this scenario. B is wrong because the scale cannot be both accurate and precise when its readings are consistently far from the true value. C is wrong because the consistent readings demonstrate precision, even though accuracy is missing from this measurement. Precision and accuracy describe two different qualities of a measurement. One CFA, and understanding them separately is a foundational skill in any science lab. Precision is about consistency. Do your repeated readings agree with each other? Accuracy is about correctness. Do those readings reflect the true value? A scale can be precise but wrong, or scattered yet accurate on average. Picture 3 groups of arrows fired at a bullseye. The first lands tightly on the center, precise and accurate. The second scatters but averages on center, accurate, not precise. The third clusters tightly but is consistently off to one side, precise but not accurate. That third pattern is exactly what a miscalibrated instrument produces. Imprecision comes from random error. Small unpredictable variations between trials, and is reduced by averaging more measurements. Inaccuracy comes from systematic error, a consistent bias, usually from miscalibration, and is fixed by recalibrating against a known standard. The two problems have completely different solutions. When you see words like consistent or repeatable, think precision. When you see close to true value or calibration error, think accuracy. Confusing the two means applying the wrong fix. So holding this distinction is as important in the lab as it is on the exam. Question 31. Hand washing has been called the single most important infection control practice in modern healthcare. The simple act of cleaning the hands between patients prevents the transfer of pathogens that can cause serious illness or death. Despite this, studies have repeatedly shown that healthcare workers wash their hands less than half the time they should. Hospitals have responded by placing alcohol-based hand sanitizer dispensers at every patient room and tracking compliance with hand washing protocols. Which of the following best summarizes the passage? Your options are: A. Hand washing is critical, but compliance is low, and hospitals have responded with sanitizer and tracking. B. Hand washing prevents the transfer of pathogens between patients. C. Sanitizer dispensers are placed at every patient room. D. Healthcare workers do not wash their hands enough. Don't overthink it. Which one feels right? The correct answer is A. Hand washing is critical, but compliance is low, and hospitals have responded with sanitizer and tracking. A is correct because A summary captures the main idea, plus key supporting points. Option A names the practice's importance, the compliance gap, and the hospital response, which together cover the whole passage in a balanced way. B is wrong because it states only one supporting fact from the opening sentence and misses the compliance problem and the hospital response that the passage spends most of its words developing as central points. C is wrong because it names a single hospital response detail rather than the passage's main point. A summary must cover the importance, the gap, and the response together, not just one piece in isolation. D is wrong because it captures only the compliance problem and ignores both the importance of hand washing and the corrective measures hospitals have introduced. A summary must reflect the whole passage rather than one slice. A summary isn't just a shorter version of a passage. It's a compressed but complete picture of the original argument. Understanding what belongs in a summary and what doesn't is a distinct comprehension skill worth mastering on its own. Every strong summary is built from 3 layers: the topic, what the passage is about, the main idea, the central claim the writer makes, and the key supporting points that back that claim up. A summary missing any one of these 3 is incomplete. Think of a partial summary like picking up one puzzle piece and calling it the picture. A true detail from the passage, say that hospitals install sanitizer dispensers, is real and accurate, but it leaves out the reason and the broader significance. The exam specifically uses true but partial details as wrong answers. Main idea and summary look similar but demand different things. Identifying the main idea is a single target task. Writing or recognizing a summary requires synthesis. Holding the main idea and its supporting evidence together simultaneously and reproducing that integrated shape. That's why both skills appear separately on the exam. Whenever you read, ask 3 questions in sequence. What is this about? What is the writer claiming? And what evidence supports that claim? A summary that answers all 3 is complete. Building this habit makes summary reliable across short passages, dense essays, and the informational texts that fill nursing coursework. Question 32. A student writes her topic in the center of a page and draws branches outward to related ideas. Which pre-writing strategy is she using? Your options are A. Outlining, B. Clustering, C. Free writing, D. Drafting. Got a guess? Lock it in. The correct answer is B. Clustering. B is correct because clustering, also called mapping, places a central topic in the middle of a page and branches related ideas outward visually. It helps writers see relationships among ideas before drafting begins on paper. Is wrong because outlining organizes ideas into a hierarchical list with main points and subpoints, typically using indentation or numerals rather than a visual diagram with branches and connections. C is wrong because free writing involves writing continuously for a set period without stopping or filtering. It produces text on the page rather than a branching visual map of related ideas. D is wrong because drafting is the stage of writing a complete first version of a piece. It comes after pre-writing strategies like clustering, not as a planning activity itself in writing. Clustering is a pre-writing strategy where a writer places a central topic on the page and draws branches outward to related ideas. Each branch can spawn its own sub-branches, forming a visual web that maps how subtopics connect before a single sentence is drafted. The visual structure is what makes clustering powerful. The central topic anchors the page. The first ring of branches captures broad subtopics, and the next ring captures supporting details. Rich subtopics with many sub-branches become major sections, while thin ones get cut. Clustering is one of 4 common pre-writing techniques. Outlining uses a hierarchical list with indentation and subpoints. Free writing means writing continuously for a set time without stopping. Brainstorming generates a list of ideas with no judgment or organization. Drafting is none of these. It is the stage that follows pre-writing. Pre-writing matters because drafting and thinking are different cognitive tasks. Pre-writing separates thinking from writing so the brain can generate and arrange ideas without the load of sentence construction. By the time drafting begins, the writer already has material and a sense of direction. When an exam item describes a central topic with branches, a web, or a visual map, the answer is clustering. Hierarchical lists point to outlining. Continuous writing points to free writing, and unorganized idea lists point to brainstorming. Matching signal words to their specific strategy is the key skill being tested. Question 33. Which chamber of the heart receives oxygenated blood returning from the lungs through the pulmonary veins? Your options are A. Right atrium, B. Right ventricle, C. Left atrium, D. Left ventricle. Which one is it? Pause the video if you need more time. The correct answer is C. Left atrium. C is correct because the left atrium receives freshly oxygenated blood returning from the lungs by way of the 4 pulmonary veins. It then pumps the blood through the mitral valve into the left ventricle. A is wrong because the right atrium receives deoxygenated blood from the body via the superior and inferior vena cavae, not oxygenated blood from the lungs. B is wrong because the right ventricle pumps deoxygenated blood out to the lungs through the pulmonary arteries. It does not receive blood from the lungs. D is wrong because the left ventricle receives oxygenated blood from the left atrium, not directly from the pulmonary veins entering the heart. The heart is a 4-chambered pump with 2 completely separate circuits. Understanding which chamber does what and why is the foundation of cardiac anatomy. Blood returning from the body, deoxygenated, enters the right atrium through the vena cavae, moves through the right ventricle, and travels to the lungs. After gas exchange at the alveoli, oxygenated blood returns through 4 pulmonary veins directly into the left atrium, then passes through the mitral valve into the left ventricle, which pumps it out through the aorta. The right side handles the pulmonary circuit, sending deoxygenated blood to the lungs. The left side handles the systemic circuit, receiving oxygenated blood and pushing it to the body. Keeping these streams separate is critical. Mixing them would reduce oxygen delivery dramatically. Each major vessel and valve is a signal word that points to a specific chamber. Pulmonary veins lead to the left atrium. The vena cavae lead to the right atrium. The aorta exits from the left ventricle. Matching vessel or valve to chamber is the entire skill on exam questions like this one. Remember, the left atrium has one job: receive oxygenated blood from the lungs via the pulmonary veins. Anchor every other chamber to its vessel, and cardiac anatomy becomes a map you can always navigate. Question 34. Which sequence correctly describes the flow of genetic information in most cells? Your options are A. RNA to DNA to protein, B. Protein to RNA to DNA, C. DNA to protein to RNA, D. DNA to RNA to protein. Take a second. Which answer would you pick? The correct answer is D. DNA to RNA to protein. D is correct because the central dogma of molecular biology states that genetic information flows from DNA to RNA through transcription, then from RNA to protein through translation. This pathway describes how genes ultimately produce functional cellular products in the body. A is wrong because RNA does not normally produce DNA inside most cells. Although certain viruses use reverse transcription, the standard cellular flow begins with DNA, not RNA, as the original source. B is wrong because proteins do not encode RNA or DNA. Proteins are end products of gene expression, not templates for nucleic acids. So this sequence reverses the actual molecular flow direction. C is wrong because proteins cannot be translated directly from DNA without an RNA intermediate. Messenger RNA carries the genetic message from the nucleus to ribosomes, which then assemble proteins. The central dogma of molecular biology describes how genetic information flows inside every cell, from DNA to RNA to protein. This directional flow is how genes become functional cellular products. DNA is the stable long-term archive protected in the nucleus. Messenger RNA is a temporary working copy exported to the cytoplasm. Proteins are the active workers, enzymes, structural components, and signaling molecules doing the cell's actual jobs. Transcription happens in the nucleus, where RNA polymerase builds a messenger RNA strand from the DNA template. That mRNA exits through a nuclear pore. At the ribosome in the cytoplasm, translation reads the mRNA 3 bases at a time. Codon and transfer RNAs deliver the matching amino acids to build a polypeptide chain. Exam questions often test this by scrambling the order. Only DNA to RNA to protein matches the standard cellular pathway. The other 3 orderings reverse one or both transitions and are incorrect. Though RNA to DNA does occur in retroviruses like HIV as a special case called reverse transcription. Keeping the sequence locked in: DNA as archive, RNA as copy, protein as worker, is the foundation for understanding transcription, translation, genetic disease, and why modern tools like mRNA vaccines work. Question 35. Which type of cell does not have a true nucleus enclosed by a membrane? Your options are A. Prokaryotic, B. Plant, C. Animal, D. Fungal. Before I reveal it, which one do you think is right? The correct answer is A. Prokaryotic. A is correct because prokaryotic cells, such as bacteria and archaea, lack a membrane-bound nucleus. Their genetic material floats freely within the cytoplasm, and they also lack other membrane-bound organelles found in eukaryotic cells. B is wrong because plant cells are eukaryotic and contain a true nucleus surrounded by a nuclear envelope. They also have membrane-bound organelles, a cell wall, and chloroplasts for photosynthesis. C is wrong because animal cells are eukaryotic. They contain a true nucleus that holds the genetic material, along with various membrane-bound organelles such as mitochondria and Golgi apparatus. D is wrong because fungal cells are eukaryotic. They contain a membrane-bound nucleus and other organelles, distinguishing them from prokaryotic organisms like bacteria that lack nuclear envelopes entirely. Every living cell falls into one of two fundamental categories, prokaryotic or eukaryotic. The single defining feature that separates them is whether the cell's genetic material is enclosed inside a membrane-bound nucleus. Prokaryotic cells keep their single circular DNA molecule loose in the cytoplasm in a region called the nucleoid. They have no membrane-bound organelles at all, no mitochondria, no endoplasmic reticulum, and no nucleus. Bacteria and archaea are the only two prokaryotic domains. Looking at both cell types side by side makes the contrast clear. The prokaryotic cell has no internal compartments, while the eukaryotic cell contains a membrane-bound nucleus and specialized organelles, each maintaining their own chemical environment. Compartmentalization is the key functional advantage of eukaryotic cells. The nucleus handles DNA replication and transcription. Mitochondria produce ATP. The rough endoplasmic reticulum handles protein synthesis. And lysosomes digest waste, all simultaneously, each in optimized conditions. Size and complexity are not reliable guides. Some eukaryotes are tiny, some prokaryotes form large colonies. The only reliable test is the membrane-bound nucleus. This structural difference also explains why antibiotics can target bacteria without harming human cells. Question 36. A line graph titled Patient Satisfaction Scores at Mercy Hospital, 2018 to 2025, shows the following values: 2018 at 70, 2019 at 72, 2020 at 65, 2021 at 60, 2022 at 68, 2023 at 78, 2024 at 82, 2025 at 85. According to the chart, in which year was patient satisfaction lowest? Your options are A. 28, B. 22, C. 2020, D. 2020. What's your answer? Commit to one before I continue. The correct answer is C. 2021. C is correct because reading the listed values, 2021 holds the lowest score at 60. Every other year shown carries a higher value than 2021. Locating the lowest point on a line graph requires comparing every plotted value across the series. A is wrong because 2018 sits at 70, which is well above the 2021 value of 60. The first year shown is not the low point. Satisfaction continued to fall for several years after 2018 before climbing again. B is wrong because 2020 is at 65, which is lower than several years but still higher than 2021's score of 60. The trough comes 1 year later, not in 2020 according to the data given. D is wrong because 2025 sits at 85, the highest value shown. The chart's most recent year shows the peak of satisfaction, not the trough that the question is asking about across the period. Line graphs are everywhere in professional reading, from clinical research to public health reports. Knowing how to extract precise values from them is a skill the TEAS tests directly, and one that matters in real clinical settings. Every line graph is read the same systematic way. First, read the title to know what is being measured. Then read the axis labels and scale to understand the units. Finally, trace the line and read off the exact Y value at the X position the question asks about. Consider a satisfaction score graph spanning 2018 to 2025. The line dips to its lowest point, 16 in 2021, then recovers to 85 by 2025. The lowest year is 2021, not 2018 or 2025, even though those are the endpoints. Only reading the actual plotted values reveals the trough. Signal words tell you exactly what to hunt for. Lowest means find the minimum Y value. Highest means find the maximum. Greatest increase or decrease means compare consecutive year-to-year changes. Matching the question's signal word to the correct feature of the graph is what locks in the right answer. The most common mistake is assuming the first or last year on a graph is the extreme. Always read every plotted value, compare them directly, and confirm your answer matches what the question is actually asking. Discipline, systematic reading beats a quick visual scan every time. Question 37. Which is the best correction of this run-on sentence? The medication is effective. It has few side effects. Your options are A. The medication is effective. It has few side effects. B. The medication is effective. It has few side effects. C. The medication is effective and it has few side effects. D. The medication is effective. It has few side effects. Pick one. Trust your gut. Here's your chance to test yourself. The correct answer is D. The medication is effective. It has few side effects. D is correct because a semicolon properly joins two closely related independent clauses without a coordinating conjunction. Both halves are complete sentences, so the semicolon binds them effectively while preserving their close conceptual connection. A is wrong because a comma alone between two independent clauses creates a comma splice. This is itself a punctuation error rather than a fix for the original run-on construction in the sentence. B is wrong because a comma between the subject and verb is not allowed and the run-on remains. Subjects should not be separated from their verbs and the clauses are still fused. C is wrong because the comma is misplaced after and rather than before it. With a coordinating conjunction joining clauses, the comma comes before the conjunction, not after it instead. A run-on sentence occurs when two independent clauses are joined without proper punctuation or a coordinating conjunction. Understanding why this trips readers up and how to fix it is the core skill being tested here. The problem is a missing boundary signal. The reader's eye expects a pause between complete thoughts, but without one. Both clauses blur together into a single hard-to-pass unit. There are exactly 4 standard fixes. You can use a period to create 2 sentences, a semicolon alone, a comma paired with a coordinating conjunction like and or but, or a subordinator to make one clause dependent. The most common trap on these questions is the comma splice, using a comma alone between 2 independent clauses. It looks plausible, but it simply trades one error for another. The critical distinction is comma alone versus comma plus a coordinating conjunction. Internalizing this single principle, that a comma alone cannot join 2 independent clauses, eliminates the most frequent punctuation error in student writing and makes correct answers on the TEAS much easier to spot. Question 38. Which structure of the cardiac conduction system is considered the natural pacemaker of the heart? Your options are A. Sinoatrial node, B. Atrioventricular node, C. Bundle of His, D. Purkinje fibers. Which would you go with? Lock it in before the reveal. The correct answer is A, sinoatrial node. Is correct because the sinoatrial node, located in the right atrium, generates spontaneous electrical impulses that set the heart rate. It is therefore called the natural pacemaker of the heart. B is wrong because the atrioventricular node receives the signal from the sinoatrial node and delays it, but does not initiate the heartbeat itself. C is wrong because the bundle of his conducts impulses from the atrioventricular node into the ventricles. It does not originate the cardiac rhythm. D is wrong because Purkinje fibers spread the impulse through the ventricular walls, causing contraction. They conduct the signal but do not generate it. The heart doesn't wait for a nerve signal from the brain to beat. It generates its own rhythm. That rhythm originates in a tiny cluster of specialized cells called the sinoatrial node, located in the upper wall of the right atrium near the superior vena cava. The depolarization wave spreads outward from the sinoatrial node through both atria, then reaches the atrioventricular node, which delays the signal by about 1/10 of a second. From there, it travels down the bundle of His, splits into bundle branches, and fans out through the Purkinje fibers to trigger coordinated ventricular contraction. Only the sinoatrial node initiates the heartbeat. It's the one true pacemaker. The atrioventricular node delays the bundle of His conducts, and the Purkinje fibers spread the signal. Exam questions list all four to test whether you know which one sets the rate. The heart has a built-in redundancy. Any tissue in the conduction system can take over pacing if the sinoatrial node fails. The atrioventricular node backs up at 40 to 60 beats per minute, and lower tissues pace even slower. This hierarchy is why heart block produces a slow escape rhythm rather than immediate cardiac arrest. When a question uses words like initiates, sets the rate, or spontaneous depolarization near the right atrium, the answer is the sinoatrial node. Words like delays point to the AV node. Conducts to the ventricles points to the bundle of His or Purkinje fibers. Question 39. Where in the periodic table are elements with the largest atomic radii located? Your options are A. Upper right corner, B. Upper left corner, C. Lower right corner, D. Lower left corner. Don't overthink it. Which one feels right? The correct answer is D. Lower left corner. D is correct because atomic radius increases moving down a group because more electron shells are added, and decreases across a period because the nuclear charge pulls electrons in tighter. The lower left corner holds the largest atoms. A is wrong because the upper right corner contains non-metals such as fluorine and neon, which are among the smallest atom due to high effective nuclear charge, pulling electrons very tightly inward toward the nucleus. B is wrong because the upper left contains small period 2 atoms such as lithium and beryllium. Although they are metals, their few electron shells make them much smaller than the heavier alkali metals. C is wrong because the lower right contains heavier nonmetals and noble gases, while larger than upper right elements. They are smaller than lower left metals because of the greater effective nuclear charge. Atomic radius follows a consistent, predictable diagonal pattern across the periodic table. Understanding why requires looking at 2 competing forces that act on every electron in an atom. Moving down a group adds new electron shells, each sitting farther from the nucleus, making the atom larger. Moving across a period adds protons without adding shells. So the growing nuclear charge pulls outer electrons in tighter, shrinking the atom. Inner shell electrons partially shield outer electrons, but within a period that shielding stays roughly constant while proton count keeps rising. The largest atomic radii sit in the lower left corner of the periodic table, where elements like cesium and francium combine many electron shells with a weak effective nuclear pull on their outermost electrons. the smallest atoms cluster in the upper right, where high nuclear charge and few shells keep electrons pulled in tightly. It helps to remember all four major periodic trends together. Atomic radius and metallic character peak in the lower left, while ionization, energy, and electronegativity peak in the upper right. Three trends share one corner and one shares the other. Once you tie them to the underlying mechanism of effective nuclear charge and shell count, they become one unified pattern instead of four separate facts. Question 40. Which of the following is the SI unit used to measure liquid volume? Your options are A gram, B meter, C liter, D Kelvin. Got a guess? Lock it in. The correct answer is C, liter. C is correct because the liter is the standard metric unit used to measure liquid volume, with smaller measurements expressed in milliliters and larger measurements expressed in kiloliters. A is wrong because the gram measures mass, not the amount of space a liquid occupies in a container. B is wrong because the meter measures length or distance, not the volume of any liquid substance. D is wrong because the Kelvin is a unit of temperature on the absolute scale, unrelated to liquid volume. The liter is the standard metric unit for liquid volume. Understanding how it scales and connects to clinical practice is essential for safe medication math. The metric system uses consistent decimal scaling. 1 liter equals 1,000 milliliters, and converting between any adjacent metric units means shifting the decimal 3 places. Conveniently, 1 milliliter of water weighs approximately 1 gram, making volume and mass easy to relate in clinical calculations. A few reference quantities make volume intuitive at the clinical scale. An adult holds roughly 5 liters of blood. A standard IV bag is 1 liter or 1,000 milliliters. A unit of transfused blood is about 350 milliliters, and a single milliliter equals roughly 20 drops from a standard dropper. Volume and mass are related through density but remain distinct quantities. 1 liter of water weighs 1 kilogram, while 1 liter of mercury weighs over 13 kilograms. Confusing the two in a clinical setting can cause dangerous dosing errors, because drugs are prescribed by mass but delivered by volume. A common exam trap is mixing up SI units that measure different properties. Liters measure volume, grams measure mass, meters measure length, and kelvins measure temperature. Signal words like solution, infusion, or capacity point to volume, while weigh points to mass. Keeping these pairings clear is the foundation of accurate nursing math. Question 41. Which of the following statements is best classified as an opinion? Your options are A. The hospital is the most beloved institution in the city. B. The hospital opened in 1965. C. The hospital has 300 beds. D. The hospital was renovated in 2020. Which one is it? Pause the video if you need more time. The correct answer is A. The hospital is the most beloved institution in the city. A is correct because most beloved is a value judgment that cannot be verified through measurement or record. The other choices describe dates, counts, or events that can be checked against documentation, which makes them facts rather than opinions. B is wrong because 1965 is a verifiable date that can be checked against records. The opening year of an institution is the kind of measurable, historical fact that fact checkers can confirm or refute through public documents. C is wrong because 300 beds is a specific number that can be confirmed by counting or by checking hospital records. Numerical descriptions of capacity belong squarely on the side of fact rather than opinion in a text. D is wrong because a renovation in 2020 is a documented event with a date attached. Whether the renovation happened can be verified through hospital records and contractor reports, which makes it a fact in this case. Distinguishing fact from opinion is one of the most important reading skills you can develop. Understanding the difference helps you evaluate any text, from medical profiles to news articles, with precision. A fact is any claim that can be confirmed against the world, a date, a number, a documented event. An opinion is a value judgment based on preference or belief. The key difference is verifiability. Facts are checkable, opinions are not. Imagine a hospital profile with 4 sentences on the same page. 3. The founding year, the bed count, and the renovation date are checkable through records or simple counting. The 4th, that the hospital is the most beloved in the city, depends on whose preferences count. That one is an opinion. Signal words make sorting easier. Evaluative adjectives like best, worst, beloved, or troubling point to opinion. Words like dated, recorded, measured, and documented point to fact. Training your eye to spot these words is half the work on any fact versus opinion item. Apply one test to every assertion. Could a third party confirm this through an objective method? If yes, it's a fact. If the answer depends on whose values count, it's an opinion. That single question handles every fact versus opinion item you will ever encounter. Question 42. Which of the following words is spelled correctly? Your options are accommodate, B. accommodate, C. accommodate, D. accommodate. Take a second, and which answer would you pick? The correct answer is C. Accommodate. C is correct because accommodate is spelled with 2 C's and 2 M's. This is one of the most commonly misspelled words in English and shows up frequently on standardized exams like the TEAS. A is wrong because accommodate uses only 1 M. The correct spelling requires doubled consonants for both C and M, producing the standard form accommodate used in formal writing. B is wrong because accommodate drops 1 C. The correct word doubles both consonants, with 2 C's followed by 2 M's, producing the proper spelling accommodate in standard English. D is wrong because accommodate substitutes an A for the second O. The correct vowel pattern is OOAE, producing accommodate as the standard correctly spelled form in formal usage. Accommodate is one of the most commonly misspelled words on standardized tests. The correct spelling has a double C and a double M, ICOMMODATE. Understanding why those doublings exist makes the spelling far easier to remember. The word comes from Latin, where the prefix ad attaches to commodare, meaning to make fit. When a D meets a root beginning with C, the D assimilates and becomes a C, giving us the double C. The double M was already in the Latin root itself, so English inherits both doublings together. The 3 most common errors each drop or change 1 doubled consonant. Accommodate drops 1 M, accommodate drops 1 C, and accommodate substitutes an A for the second O. Seeing these wrong forms side by side sharpens your ability to recognize the single correct spelling. There are 3 reliable memorization strategies. First, write the word by hand with the doubled letters marked in a different color to build motor memory. Second, use the mnemonic 2 C's of coffee and 2 M's of milk. Third, recall the Latin origin, the double C from prefix assimilation, the double M from the root itself. Accommodate has tripped students for generations, but its spelling is logical once you know the Latin roots. Master the small list of high-frequency error words and you'll gain an edge on every standardized test and professional document you ever write. Question 43. Which of the following best describes the structural feature that allows capillaries to perform their primary function? Your options are A. Thick muscular walls for high pressure, B. One-way valves to prevent backflow, C. Elastic walls that recoil with each beat, D. Walls that are only 1 cell thick, Before I reveal it, which one do you think is right? The correct answer is D. Walls that are only 1 cell thick. D is correct because capillaries have walls only 1 endothelial cell thick. This minimal barrier allows oxygen, carbon dioxide, nutrients, and waste to diffuse rapidly between blood and surrounding tissues. A is wrong because thick muscular walls are characteristic of arteries, which must withstand high pressure. Such walls would block diffusion across capillaries. B is wrong because one-way valves are found in veins to prevent backflow against gravity. Capillaries do not contain valves of any type. C is wrong because elastic recoil walls are typical of large arteries near the heart. Capillaries are not designed to expand and recoil with pressure. Capillaries are the body's exchange specialists, and their 1 cell thick wall is the structural key to understanding how that exchange works. The capillary wall is just 1 endothelial cell thick. That minimal distance is what makes rapid diffusion possible. Oxygen and nutrients move out, while carbon dioxide and waste move in, all within seconds. Exchange relies on 2 mechanisms: diffusion, where oxygen and nutrients move down concentration gradients into tissue and waste moves back into blood, and filtration, where pressure drives fluid out at the arterial end and osmotic pull reabsorbs it at the venous end. Each vessel type has a wall structure that fits its job. Arteries withstand pressure with thick muscular walls. Veins prevent backflow with valves. Capillaries need neither. Their thin wall is the design optimum for exchange, and any added thickness would only slow diffusion down. When a question mentions exchange, diffusion, thin wall, or single-cell endothelium, the answer is capillaries. Thick muscular walls mean arteries. One-way valves mean veins. Holding these 3 pairs together makes vascular anatomy questions straightforward. Question 44. A red blood cell placed in a hypertonic solution will most likely do which of the following? Your options are A. Swell and possibly burst. B. Shrivel and shrink. C. Stay exactly the same size. D. Begin to perform photosynthesis. What's your answer? Commit to one before I continue. The correct answer is A. Swell and possibly burst. A is correct because a hypertonic solution has a lower solid concentration outside the cell. Water moves into the red blood cell by osmosis to balance solid levels, causing it to swell. Because animal cells lack walls, they may rupture. B is wrong because shriveling occurs when a cell is placed in a hypertonic solution, where water moves out of the cell. Hypertonic conditions cause water to move in, leading to cell swelling instead of shrinking. C is wrong because staying the same occurs in an isotonic solution, where solid concentrations are equal on both sides. In a hypertonic environment, net water movement causes a noticeable change in cell volume. D is wrong because red blood cells lack chloroplasts and cannot perform photosynthesis. The presence of a hypertonic environment does not enable a human animal cell to begin synthesizing glucose from light. Osmosis describes how water moves across a semi-permeable membrane, always toward the region of higher solid concentration. The tonicity of the surrounding solution determines whether a cell swells, shrinks, or stays the same. There are 3 named conditions. In a hypertonic solution, solute concentration outside the cell is lower, so water flows in and the cell swells. In a hypertonic solution, solute concentration outside is higher, so water flows out and the cell shrinks. Isotonic means equal concentration on both sides, no net movement and stable cell volume. In a hematology lab, these differences are visible under the microscope. Cells in isotonic saline keep their normal biconcave shape. Cells in distilled water swell and burst, a process called hemolysis. Cells in concentrated saline shrivel into spiky echinocytes through a process called crenation. Exam items often list both swelling and shrinking as options. The key is anchoring the direction correctly. Hemolysis and bursting signal hypertonic conditions. Crenation and shriveling signal hypertonic conditions. A useful memory hook. Hypo means low solid outside, so water moves in. Tonicity is not just a lab concept. Kidneys, brain cells, and intestinal cells all depend on osmotic gradients to function. Recognizing the three tonicity terms and their predictable effects on cell volume is the foundation for understanding fluid balance across the entire body. Question 45. A researcher needs to convert a mass given in kilograms into grams. Which operation should be performed? Your options are A. Divide by 100. B. Multiply by 1000. C. Divide by 1000. D. Multiply by 100. Pick one. Trust your gut. Here's your chance to test yourself. The correct answer is B. Multiply by 1000. B is correct because 1 kilogram equals 1000 grams. Converting from the larger unit to the smaller unit requires multiplying the kilogram value by 1000. E is wrong because dividing by 100 would not produce the correct conversion between kilograms and grams in any case. C is wrong because dividing by 1000 would convert grams into kilograms rather than the other direction described. D is wrong because multiplying by 100 is the conversion factor between meters and centimeters, not kilograms and grams. When converting between kilograms and grams, everything comes down to one relationship. 1 kilogram equals exactly 1000 grams. The metric system makes this straightforward because every prefix represents a consistent power of 10. Going from kilograms to grams means multiplying by 1000. Watihi, the decimal point shifts 3 places to the right. Reversing direction, grams to kilograms, means dividing by 1000, shifting the decimal 3 places to the left. This simplicity is the core advantage of the metric system. Every prefix, kilo, centi, milli, represents a fixed power of 10. Imperial units like 16 ounces per pound or 2,000 pounds per ton have no such pattern and must be memorized individually. For example, 2 kilograms equals 2,000 grams, and 5,500 grams equals 5.5 kilograms. The decimal point moves 3 places in the direction of the conversion. The reliable anchor is this: a kilogram is a bigger unit than a gram, so any mass expressed in grams is a larger number than the same mass in kilograms. When moving from a bigger unit to a smaller one, always multiply. That single rule eliminates the most common direction error. Question 4X. All the patients in our small study who took drug X recovered fully within 2 weeks. We should make drug X the standard treatment for this condition. Which of the following is an unstated assumption in the argument? Your options are A. The study patients are similar enough to the general patient population. B. Drug X has been on the market for a long time. C. Drug X is expensive. D. Recovery without treatment is unknown. Which would you go with? Lock it in before the reveal. The correct answer is A. The study patients are similar enough to the general patient population. A is correct because the argument leaps from a small sample's full recovery to a recommendation for everyone. That leap depends on assuming the study patients are representative of the wider population. If they are not, the recommendation collapses entirely. B is wrong because how long drug X has been on the market is not required for the argument's logic. The recommendation depends on study results and a generalization assumption, not on the drug's market history at all in this case. C is wrong because the argument never raises cost as part of its reasoning. Whether the drug is expensive is irrelevant to the inference from a small study to a general standard treatment recommendation here. D is wrong because the argument does not depend on knowing the natural recovery rate. The author asserts recovery happened with the drug and recommends adoption based on that observation, not on a comparison with untreated patients. Every argument rests on premises, but not all of them are spelled out. An unstated assumption is the hidden premise an argument depends on to connect its evidence to its conclusion. The method is always the same. Locate the conclusion, identify the stated premises, then ask what additional premise must be true for those premises to support that conclusion. That required missing link is the unstated assumption. Think of the argument as a bridge. The stated premises are one side, the conclusion is the other, and the unstated assumption is the span in between. Remove it and the whole structure collapses, even when every stated premise is correct. This gap appears constantly. A clinical trial recommends a drug assuming patients in the study represent everyone. A policy assumes implementation works as planned. A business case assumes market conditions hold. A correlation claim assumes the link reflects an actual cause. On any assumption question, ignore options that are merely true facts about the situation. The correct answer is the specific premise that closes the logical gap between what is stated and what is concluded. That gap is exactly what the question is testing. Question 47. Which sentence is the most concise revision of, due to the fact that the patient was experiencing nausea, the medication was discontinued by the doctor? Your options are: A. Due to the fact that the patient had nausea, the doctor discontinued the medication. B. Because the patient was experiencing nausea, the medication was discontinued by the doctor. C. The patient was nauseated and the medication was discontinued by the doctor. D. Because the patient had nausea, the doctor discontinued the medication. Don't overthink it. Which one feels right? The correct answer is D. Because the patient had nausea, the doctor discontinued the medication. D is correct because this revision replaces the wordy phrase due to the fact that with because simplifies was experiencing to had and converts passive voice to active voice. The result is shorter and clearer overall. A is wrong because it retains due to the fact that the wordy phrase that should be replaced with because. Concise writing eliminates such redundant phrasing whenever a single shorter word will work effectively. B is wrong because it retains both was experiencing and the passive construction was discontinued by the doctor. Active voice is more concise and direct than passive in this context for clarity. C is wrong because it retains the passive voice was discontinued by the doctor. Active voice is shorter and clearer when the doer of the action is known and meaningful in context. Concise revision means rewriting to remove unnecessary words without losing meaning. The goal isn't just shorter sentences, it's clearer, faster prose that respects the reader's time. 3 specific targets drive most of the wordiness in student and professional writing. The 3 targets are wordy phrases, weak verbs, and passive voice. Wordy phrases like due to the fact that collapse to because. Weak verbs like made a decision sharpen to decided. And passive constructions like was discontinued by the doctor flip to active, the doctor discontinued. Here's all 3 repairs applied to one sentence. Due to the fact that becomes because, was experiencing becomes had, and was discontinued by the doctor flips to the doctor discontinued. 17 words drop to 11, and the actor and action become explicit. On test questions, wrong answer choices each fix only one of the 3 targets and leave the others untouched. Only the correct option repairs all 3 simultaneously. If a revision still contains a wordy phrase or a passive construction, it is only partially concise. And partially concise is still wrong. Train yourself to ask 3 questions on every sentence. Can a phrase shrink to 1 word? Can a weak verb become strong? Can passive become active? When you can answer yes to all three, you have the fully concise revision the exam is looking for. Question 48. Which of the following is a sentence fragment? Your options are A. Although the medication was effective. B. The doctor reviewed the chart carefully. C. The patient is resting in room 207. D. After the surgery, the patient slept. Got a guess? Lock it in. The correct answer is A. Although the medication was effective. A is correct because although the medication was effective is a dependent clause standing alone. The subordinating conjunction, although signals that the clause needs an independent clause to complete the thought it begins. B is wrong because the doctor reviewed the chart carefully is a complete simple sentence with subject, verb, and object. It expresses a complete thought without needing additional clauses to function. C is wrong because the patient is resting in room 207 is a complete simple sentence with a subject, verb, and prepositional phrase. It expresses a complete idea independently and clearly. D is wrong because after the surgery, the patient slept contains an introductory phrase plus an independent clause with subject and verb. The structure forms a complete sentence overall. A sentence fragment looks like a sentence but is grammatically incomplete. Understanding what makes a sentence whole comes down to testing for three essential components. Every grammatically complete sentence must have three things: a subject, a verb, and a complete thought. Remove any one of these and you have a fragment. The tricky case is when all three seem present, but a subordinating conjunction blocks the thought from being complete. Subordinating conjunctions like although, because, while, when, if, unless, after, before, since, and until turn an otherwise complete clause into a dependent one. The clause now needs an independent clause to finish the thought. Spotting one of these words at the start of a period-bounded unit is the fastest way to flag a fragment. Here you can see the difference directly. The fragment contains a subject and verb, but the subordinator, although, means the thought is incomplete. The reader is left waiting. Attaching an independent clause resolves the fragment and delivers the full idea. The quickest check is the stand-alone test. Ask whether the unit could answer a question on its own. Although the medication was effective cannot stand alone. The medication was effective can. Run this test on every sentence you write and every option you evaluate on an exam. Question 49. Two heterozygous parents, BBXBB, have a child. What is the probability that the child is homozygous recessive? Your options are A. 0%, B. 25%, C. 50%, D. 75%. Which one is it? Pause the video if you need more time. The correct answer is B. 25%. B is correct because crossing two heterozygous parents yields offspring in a 1:2:1 genotype ratio. 1/4 are homozygous dominant, half are heterozygous, and 1/4 are homozygous recessive in the resulting Punnett square. A is wrong because both parents carry a recessive allele that can be passed on. There is a real chance, not zero, that a child inherits two recessive alleles from this cross of parents. C is wrong because 50% represents the heterozygous offspring fraction in this cross. Half of the children are expected to be BB, but only a quarter will be homozygous recessive overall. D is wrong because 75% reflects the proportion showing the dominant phenotype, including BB and BB together. The homozygous recessive genotype itself appears in only a quarter of the offspring. When two heterozygous parents cross, the offspring genotypes follow a predictable 1:2:1 ratio. Understanding why requires Mendel's law of segregation and a careful look at what a Punnett square actually counts. The Punnett square lays out 4 equally likely outcomes: BB, 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 and BB. Each cell is the product of 2 independent 50-50 gamete chances, which is exactly why every box carries equal probability. 1/4 of offspring are homozygous dominant, half are heterozygous, and 1/4 are homozygous recessive. This 1:2:1 genotype ratio is distinct from the 3:1 phenotype ratio you get under complete dominance. The classic exam trap is substituting the 75% phenotype frequency for the 25% homozygous recessive genotype frequency. Spotting whether a question asks for a genotype or a phenotype is the entire skill. They look almost identical but require different counting. Before answering any probability question on a monohybrid cross, draw the Punnett square. Count BB, BB and BB cells separately, then divide by 4. That 10-second habit prevents phenotype versus genotype confusion on every genetics problem you encounter. Question 50. A student uses a beaker to measure a liquid for an experiment requiring extremely precise volume. What is the main weakness of this choice? Your options are: A. Beakers cannot hold liquids safely. B. Beakers always contaminate samples. C. Beakers measure mass instead of volume. D. Beakers provide only rough volume estimates. Take a second. Which answer would you pick? The correct answer is D. Beakers provide only rough volume estimates. D is correct because beakers have widely spaced volume markings intended for approximate measurements, so using one when high precision is required can introduce significant measurement error into the experiment. A is wrong because beakers safely hold liquids in laboratories, and safety is not the central issue raised by precision requirements. B is wrong because clean beakers do not automatically contaminate samples, so contamination is not the precision flaw described here. C is wrong because beakers are designed to hold liquids and are not used to measure mass under any condition. Different laboratory glassware exists because different tasks demand different levels of measurement precision. Understanding which vessel to reach for depends on whether your experiment needs an approximate volume or an exact one. Beakers and Erlenmeyer flasks are wide and convenient, easy to pour and stir, but they sacrifice precision. Graduated cylinders offer accurate volume readings with fine markings, while volumetric flasks and pipettes each carry a single calibrated mark for the highest possible precision. Geometry explains why narrow vessels are more precise. In a wide beaker, adding a small volume barely changes the liquid height, making it nearly impossible to read accurately. In a narrow graduated cylinder, that same volume produces a much larger, easier to read height change. Exam questions telegraph the right answer through signal words. Terms like precise, exact, or quantitative point to graduated cylinders or volumetric glassware. Words like rough, approximate, or mixing point to beakers and Erlenmeyer flasks. A single calibrated mark always means volumetric glassware. The core principle is simple. Choose your glassware based on what the experiment actually requires. Convenience glassware is fine for holding and mixing. Precision glassware is essential whenever an exact volume determines the outcome.
You have reached the end of our first question set. For the free complete exam preparation, visit our website link in the description, where you find thousands more practice questions and comprehensive study guides. Thanks for studying with us today. See you in the next video.